Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
Tracy, you may have heard the term on-call. In fact, just thinking about it, my heart starts to go a little faster. Well, it refers to when doctors can respond quickly, get to the emergency room, and treat patients in short order. And that's just what happened for one Mayo Clinic surgeon when a teenage patient was airlifted to the Mayo Clinic in Rochester with an arm that was severed just below the elbow. The question, what to do about it? Well, the answer, put it back on.
Replantation, is that what we're calling it?
Exactly. Replantation of the hand.
Replantation is the surgical reattachment of a finger, hand, or arm that has been completely severed from the body. Reattachment in this case involved two bones as well as muscles, tendons, and blood vessels. Here to share the story is the physician who performed this limb-saving procedure, hand and plastic surgeon Dr. Carlson. Welcome to the program, Dr. Carlson. It's nice to meet you.
Oh, thank you for having me.
Yep, good to have you here. So take us back to the day. You were on call. You weren't in the hospital, I assume, and they called you from the emergency room and they said, we have a problem.
That's correct. They called me. Usually we get the calls an hour or so heads up, but this one came quickly. He had, I think because they moved so quickly in the field where he was, and got him, I got a call when he was at the airport in Rochester, and so I was able to quickly get to the hospital and see him as he was arriving and wheeling into the operating room.
And what was the first thing you saw?
I saw a young man that was actually remarkably brave and stoic and managing. I saw him and his face before I even saw his limb and his
So he brought his arm
injury.
with him.
He did bring his arm
He
with
didn't
him.
have to go back and get that.
No, and that was wise. It was his stepmother, I believe, that has some healthcare background and was mindful and kind of knew. She wrapped it in a bag and put it on ice, just like you're supposed to do, and it got here right there with him.
How long from the time that he was injured and cut off was it hand or half of his arm?
It was about the middle to distal.
Okay, just above his wrist.
Yep.
So
How long?
How did he do it?
He was doing some woodworking in the yard with for his father, and he was cutting some pieces of wood. I can never quite exactly put together in my head how these saws work, but his sleeve, it was a cooler fall day. Sleeve got caught in the saw, pulled the arm in, and these things happen so quickly.
It was completely severed. I mean, it was
completely
not
severed.
At all attached.
No, which is good and bad. I mean, sometimes when they're partly attached, we struggle with the tissues that are attached, trying to save them, and sometimes when they're completely off, it makes things a little bit easier. We can adjust the material we're working with.
What was the time frame between when that accident happened and when he was getting wheeled in and you were going to start?
I don't remember exactly, but it was on the order of a couple of hours, which is very quick. I mean, to imagine getting 911, first responders, helicopter, all of those things in motion.
No, I know that there are sometimes you can replant a part, put it back on, and sometimes you can't. How do you make that decision?
Well, there's a lot of things that go into that decision, and probably more than we want to get into here. But patient factors, is the patient mentally able to participate in therapy, and is it something that they would want? So some patients, if you cut off your fingertip, we can technically put a fingertip back on, but that may require a week in the hospital with perhaps leech therapy, which we don't need to get into, but it can be very involved and more trouble than it's worth, especially for someone who's a laborer or just wants to get back in the field or get back to work, and perhaps even for a surgeon. We know surgeons can do well without all their digits.
And there's a difference too, isn't there, between a relatively clean cut and a crush injury? If all the tissues at the site are crushed, it's more difficult to get everything to survive than if it's fairly clean cut.
That's exactly right. And we were lucky in this situation. It was a very clean cut. Patient factors and then injury factors, and then timing too. Timing is an important one. If it's been a long time in transport, the tissues cannot be resuscitatable or revivable.
But being on ice helps.
Well,
Putting
yeah,
on
you
ice
said
helps,
the family member had some medical training, so knew, put it in a plastic bag, put it on ice. How long can a limb survive? How long is it viable for replantation?
That's a really good question. So it depends on the metabolic activity of the tissue. So a fingertip can last, believe it or not, several days
Oh my
of cold ischemia. And even I think the longest of warm ischemia, so something that's not
Ischemia
even
means no blood.
no
lack of blood,
circulation
yeah.
to it, and so completely detached. Even with it not on ice, I think the longest is about a day and a half, 36 hours. But that's because the tissue, the fingertip, the skin, and the fat doesn't have a lot of metabolic activity. It's not burning a lot of energy, and it's that process that causes the irreversible tissue destruction. But things like muscle, nerves, do have a lot of metabolic activity, and there's a lot in the hand itself, a lot of muscle tissue. So you have to act fast. So for him, it's about 6 to 8 hours of ischemia.
So how do you go about reattaching someone's hand? Where do you start? How does that work out?
There actually are algorithms for this. So you want to start with the bone. Because if you start with the more delicate soft tissues, it will be floppy, and those will be at risk for, falling coming apart. So if you stabilize the bone first, and then that way you're working with a solid structure. I imagine just like framing a house, and then you can work with the soft tissues, and then
Plate and screws to put the bones back
plate
together.
and screws to put the bone back together, and then more delicate suture and things to put the nerves and blood vessels back together. You want to do get the vessels, depending on how long it's been without circulation, you want to get that going probably after the bone or shortly after the bone. With him, we had the luxury of time. So if it's bloodless field, it makes things easier to put together. So we put a lot of things together before we actually attached the blood vessels because of how favorable the setup was, how clean of a cut it was. And
Now, how did he not bleed to death? I mean, the blood vessels in the mid-forearm are pretty good size.
that's a really good question. And it's remarkable. I think I've been taught that when blood vessels are cut at 90 degrees, transected, that they're more able to spasm.
Stop it. Really? You guys, I feel like you're trying to trick me.
I don't know, Dr. Shives, is that true?
So you think that the vessels clamp
they're
down
able to
on their own?
spasm, with the transection versus a. I know it's true. We see arterial injuries. This is obviously the most severe you can get, but we see arterial injuries where the artery is completely cut. And it's missed. They say there's a lot of bleeding at the scene, and then by the time they get to the emergency department, the bleeding has stopped. They put pressure on it. People are that's an intuitive response, and people don't usually have to be taught that, but you put pressure on it, and that provides the body enough time to clot it off, and it doesn't re-bleed.
How do you train for a surgery like this, or how do you? It doesn't happen every day. How often is this something that you have to do?
Well, I mean, this is a unique injury, and I do think it's one of a kind at this level, but we do reattach parts here. That we did look at our numbers not too long ago. It was about 50 reattachment procedures per year, or revascularization. They're similar complexity, so they're usually looked at together. But every case is unique. Ironically, we do have a hand transplant program, and so we have been preparing for a hand transplant, and so this is a very typical level for a hand transplantation. So I actually had rehearsed this particular operation on the cadaver.
He's got his
practiced.
Yeah,
I
he
had
just got
actually
his own.
practiced, so
Yeah.
this was lucky for him and
He
lucky
got his
for
own
me
hand
both, yeah.
back. That was his transplant.
Yeah.
All right, so a lot of this is done with the microscope, and I know it's intricate. How many hours did it take to get this all done?
I don't it was not. It went fairly well.
8?
6 hours, 6 to
7?
8 hours. Yep.
Perfect.
Yep.
And how's he doing?
Really well. Really well. I mean, I couldn't have happened to a better person, as
'Cause he's young.
twisted as that might say.
Sure.
But yeah, he's young, he's brave, and he really didn't flinch.
And
a lot of people would have a really hard time, but he did therapy. So when we reattached the limb, he started therapy just in the days after reattachment, and he stayed at the Ronald McDonald House and got several hours of therapy a day.
And you mentioned leeches. Did you use leeches to help restore
We did not
the
use
blood flow?
leeches. No. If we're using leeches, it's a bad day for us. It means
Okay.
there's a problem.
All right.
So we didn't use leeches for
All
him,
right.
thankfully. Yeah.
Well, glad he's doing well. And he had
Yeah.
a great doctor. Dr.
thank
Brian
you.
Carlson, plastic surgeon, hand surgeon, Mayo Clinic, Rochester. Thanks so much for being with us.
Well, thank you for having me.